Hi, I'm Mina Malik Hussain, and you're watching The Coffee Table. And today we have a wonderful show. It's always wonderful. But you know, I feel like some topics are more serious than others. It doesn't take away from the importance of any of these shows. I think every show that we do is really important, but some shows are more delicate than others, and this is one of them. Today we're going to be talking about grief and trauma management and how one wonderful organization has been doing incredible work in helping people, survivors of terrorist trauma and survivors of any kind of grief and bereavement cope with a life-changing event. And the thing is that all of us at some point in our lives will experience some form of grief or bereavement or trauma. And the fact that a lot of us live in geographical areas where we are more exposed to violence and trauma than other places. And these are all things that we can't necessarily control. But the good thing is that there is always help available, and one should not ever have to feel like one is dealing with trauma and grief alone, and neither should you have to cope alone, because, you know, thank goodness that there are people out there whose work is just magnificent and doing so much for communities and individuals across the country, for sure, if not internationally. So I am so honored to be welcoming on the show today Dr. Fatima Haider, who is a medical doctor as well as an EMDR therapist. She's the co-founder of the Grief Directory, which she set up in 2015. She has read for an MSc in Peace and Conflict at the University of Ulster in Northern Ireland, and is also pursuing a PhD there where the focus on women affected by conflict in Pakistan. We are also joined by Zehra Kamal, who is an Islamabad-based psychologist. She specializes in global mental health and trauma. She supervises the counselors of the mental health helpline Roseanne and also volunteers with the Grief Directory. And we've also got Shafaq Sohail on, who is a LUMS grad, majored in anthropology and sociology, and has been with the Grief Directory since 2018. Welcome to the show, all three of you wonderful women. So, Zehra, I'd like to start with you, since you're our psychologist. Could you, when we think about grief, and you know, like as I always say on this show, I like to begin at the beginning. When we talk about grief, we are always talking about loss. But I think that we also tend to conflate bereavement with grief. So could you sort of tell us what the difference is between those two things?
I think, thank you for inviting me on the show. I think these are different terminologies that are used interchangeably. So basically, whenever somebody experiences any form of loss, the loss could be of a relationship, the loss could also be of a place, and the loss could be of people. So the process that one goes through, the process of sort of the various emotions that one has to deal with, that interchangeably is used as a process of grief, as a process of bereavement. So I would say that these terms are used interchangeably. And for everybody, I think the process does not follow a pattern. It does not follow a timeline. You must have heard of these famous 5 stages of grief. And a lot of research says that there is no order in how you grieve, and there is no right or wrong way. Human beings are different, their experiences are different, and when we talk a bit later about violent acts of terrorism and how grief looks like in that, and how it may be different, that's a whole different story altogether.
Yeah. So, Fatima, tell me about the Grief Directory. You set it up in 2015, and since then you have the organization has done so much incredible work with so many people who have experienced grief and loss in some form or the other. But before the Grief Directory, I don't think that we had any kind of institutionalized sort of some sort of proper organization which was actually having these conversations.
Yeah, thank you so much. I think that before I talk about why we set up the Grief Directory and how we identified that vacuum that existed, I would like to share my own experience as a medical doctor. So I was working as a GP until 2013. And my biggest learning during that time was the importance of listening. So as a GP, I felt that many patients who came to me did not need psychological support. They just wanted a listening ear. Something I think which is very, very important and which should be given more emphasis when we are training our medical doctors. Yeah. Then on a second level, when I lost my husband and son, and before that, my family unfortunately lost my father in a plane crash as well. So we faced two major tragedies in 7 years. My second realization was that how to address the grief of women who've been left behind and are basically not breadwinners, and they have to fit in the shoes of their late husbands in a very, very deeply patriarchal culture. Yes. So how to address that? And that applies not just to women who've been widowed, but also to women who have faced tragedies and their husbands have been disabled. So that's the struggle of women. Then on another level, we don't have conversations or enough support for children who have been affected by such violent tragedies. Yes. We never talk about their grief. No, we never talk to them. We never sit with them and try to help them understand what has happened. And Zehra can comment on it as an expert more deeply. But that was my understanding, that we lack such spaces and such support. Yeah. Thirdly, especially for boys, when women have been widowed and boys have been left behind, they are often given, young adolescents have been given the responsibility of taking care of this family. Yes. We snatch away their childhood experiences. So how to address their trauma as well? So they suffer, they try to look after their families, and they try to fulfill the expectations of the people around them, and they also have to try to fit in the shoes of their late fathers. Yes. So that was my personal experience. And based on that, we also realized that on a state level, unfortunately, we don't have any institutions for the support of civilian victims of terrorism. Yes. And that's how we set up my co-founder, Dr. Nureen. She's not here today with us in the program, but she helped me actually understand the need for such an organization, and that's how we started our work. Then the third level at which we realized was that one is the grief of trauma due to violent conflict. So families suffer, and that was my personal experience as well. Then we got in touch with other families as well. Yeah. But another realization that we had through our Facebook page was that there was general need to talk about the trauma. So you don't have support groups for women who've lost their spouses. You don't have support groups for adolescents and young students who are suffering maybe from depression, maybe from other issues. And you don't have support groups for mothers who have lost their children. These are such difficult conversations that our society decides not to talk about them, then address the pain. And the one who's suffering feels isolated. So that has been my experience.
No, absolutely. And I'm really glad you brought up how it also seems to be, and I don't want to necessarily pin this discomfort with talking about trauma and grief to any one culture. But Shafaq, maybe you can weigh in on this. Do you feel like generally as humans, we are kind of programmed to just feel deeply uncomfortable talking about this and not know how to talk to people who are grieving? Or do you feel like some cultures do adapt better and some cultures' ideas about death and loss are more sort of flexible than other cultures?
Absolutely. Thank you so much for the question, Mina. I think it is not something that's intrinsic to human beings as such. It has a lot to do with culture, but even within cultures, we need to realize that if the dominant culture does not allow for the expression of grief, there are pockets that still exist within culture. So for instance, as a student, I was doing an ethnography of the shrine of Maud's Darya, right? And one of the biggest realizations I had there was that these are spaces that are so conducive to discussions on grief, sorrow, personal issues that are not that mainstream in other public spheres, right? So women who did not know each other, who didn't who never met each other before, who will probably never meet each other again. We're talking about their personal issues, the domestic abuse they face, their abusive children, abusive husbands, right? The loss of family members. They had those conversations, they cried together, they shared their grief, and then they would go their own separate ways, right? So those spaces, those little pockets still exist within our society's very poverty. And I think the next step then is to identify these spaces and to amplify and perhaps replicate those spaces. And another point that's linked to this is, again, of recognition that Dr. Fatima also talked about. But I think before extending that recognition to others, we also need to turn that gaze inwards, right? So for instance, for TGD, the Grief Directory, when we're having a summer internship with students, before talking about the grief or the experiences of victims of terrorism, we talk about their own lives. We talk about, we encourage students to talk about their own vulnerabilities, experiences that shape them, experiences that haunt them, right? And those conversations in turn help them acknowledge that there is nothing wrong with vulnerability. There is, vulnerability is a human condition that connects us all, right? Which is why empathy then is not this switch that you turn on when you're talking to somebody who's grieving. It's rather a practice that you actively try to incorporate in your life and in your approach and your interactions with anybody. So I think it is cultural in many ways, but you're right, like this is not particular to any one society. It's present across board. But again, we need to recognize that it's not ahistorical, it's not intrinsic, it's not biological, and it can change.
So quite important, Zehra.
Add to what Dr. Fatma and Shafaq were saying, one thing that we have to sort of be aware of is the fact that whenever somebody experiences a difficult life circumstance and a violent one, we call these potentially traumatic life experiences, because when we just say trauma, or we use the word that everyone is traumatized, because there's a lot of debate that we medicalize a lot of issues. And so what Dr. Fatma was saying about the importance of listening, and so people who go through difficult life experiences, even a terrorist attack, they may be potentially traumatic life experiences, but not necessarily fall in the category of trauma or a post-traumatic stress disorder. Because when we pathologize life experiences, we do not look at our approach, our interventions, and our approach to addressing them become very medical. You know, that this person needs trauma therapy, this person needs to sit and talk about their experiences, and human beings are more complex and complicated than that. And a lot of research shows that people need support with their daily stressors. They need support with how to manage their day-to-day lives. And some people, and we said that grief, and so you can lose a place, but when you actually lose a loved one, which is more the bereavement, that some people would not want to talk about it. Some people would want to avoid places and situations. And a lot of research shows that it has to be a mix of both. You talking about these issues, but at the same time, people also protecting themselves, going on with their lives, functioning in a day-to-day basis, and avoiding certain reminders. So it's a mix that happens for people that enables them to move on. And I also wanted to, because we are talking about the Grief Directory, I don't want to trivialize the experiences of those who go through violent losses and deaths and disability, because that is way different from somebody losing a loved one in just a road accident, or which can also be potentially traumatic, or due to illness or injury, due to any kind of illness. Because this sudden shock, or the meaninglessness of the death, or this fear that, you know, why are people after us? Why are people after a certain group? So that a lot of people make meaning of the loss, right? After you, as part of grieving, a lot of my own work also shows that people try to make meaning that, okay, the person was unwell and so it's for the better. But how do you make meaning of something which is barbaric? And that
and unnatural.
So that I just wanted to highlight that.
No, I think that that's a very crucial point, and I want to unpack it in a little more detail. But first, we're going to take a very quick break. Stay with us. Welcome back to the coffee table. We're having a vital conversation about grief and trauma and how to cope with that with Dr. Fatima Ali Haider, Zehra, Kamal Alam, and Shafaq Sohail, all three of them from the wonderful organization, the Grief Directory. So before the break, we were talking about trauma, and we were talking about how there are different kinds of trauma, and there is some trauma which is sort of caused by events that are kind of natural but still upsetting. And then there is trauma caused by unnatural and violent events. But regardless of what is causing that trauma or grief, Fatma, can you tell me about the kind of support that grieving people need from their families?
Thanks, Mina. Mina, I think that in our culture, where extended family and friends are very involved in offering support and they're very willing to support, I think it's very important to hold such conversations when you're trying to support a family which has been affected by a sudden violent conflict trauma. Because our cultural norms are that we offer support for the first 40 days.
Yes.
And I still remember that I sat down on the dining table and cried bitterly on the 41st day because there was no one. And I was still missing my husband. I was suffering because I was missing my child. My elder son was missing his brother. So I think that what these families are struggling with is to build a new normal. But because they were not, unfortunately, prepared for it,
yes.
So they need support in longer frame of time as compared to prolonged illness, which sort of sometimes already mentally prepares you for what is coming. So I would like to extend this point and say that while it's very, very important for such families to seek psychological support if needed, they also need family support. And what the family and friends can do is probably, rather than saying that, I've frequently heard this sentence that if you need anything, just let me know.
Yes.
Well, I think the one who's in pain and who's suffering, number one, finds it difficult to identify the needs, and number two, sometimes feels uncomfortable asking for support. So keeping in touch with those families and the bereaved ones on a regular basis is really, really crucial. So if you check up on them once a week, or sometimes sit down on the table with them when they're missing their loved one. So having a meal with them, giving the mother a break from babysitting so that she can visit the graveyard, or maybe accompany her to the graveyard. These are very, they are very taken as very routine activities. But sometimes they become a struggle for those families. Absolutely. So it is very, very important that people keep on reaching out to them. Then I think on a second level, it's very important for our mental health professionals to realize this and to engage the family in such conversations and help the extended family understand how the needs of these traumatized family members can be addressed. Because in many cases, I think they are willing to help, but they just don't know how to understand that. So I think a trauma-focused training, and of course, Zehra can extend on it to her expertise. So these trauma-focused trainings for our mental health professionals is very, very important for helping these families.
Absolutely. And I come back to family also, because often when traumatic events occur, one immediately thinks of immediate family, for example, a spouse or a child. But then there are also parents and siblings and aunts and uncles and cousins. And it's a whole, because no man is an island, like everybody is operating within a larger family structure. And I think it's important to consider entire families as a grieving unit, as it were, where everybody needs some kind of emotional support. And but Fatma, do you think that it's also an unfair expectation on any one family member to provide that kind of support to the other, because everybody is grieving?
Yes, of course, Mina. We talked about the concept where if you're in caregiving for longer periods of time, you can experience exhaustion. And I think that's where not just the extended support of the extended family comes in, and it is really, really important. But I think to provide support in a very organized fashion is very important. So,
right.
and then I think on a larger level, probably Shafaq can talk about it more, how it is important for the society to help these victims on a larger scale. So I think we all have, as human beings, we all have to fulfill our social responsibility towards the ones who are suffering around us.
No, I think that is very important. And Shafaq, I will come to you in just 1 second. But before that, Zehra, I wanted to ask you, could you explain what the 5 stages of grief are?
Sure, I'll just go through them briefly, and I think the 5 stages that are often talked about, and they're sort of that's denial, anger, bargaining, depression, and acceptance. But what I'm saying is that these are the stages that's kind of what was often believed, but there is no way that the grief goes through these stages, and that there's a particular order. People are different, like I said, and human beings do things differently. So there's no right and wrong. A bit of avoidance happens, a bit of functioning happens, a bit of talking happens. I wanted to build on what Dr. Fatima was saying. I did a small scale research again in communities in Lahore which were affected by terrorist attacks. And for the parents who had lost a child in a terrorist act, as well as for children, one important source of support was family. And for all the things that Dr. Fatma has mentioned, and this can be very important. And I also want to highlight that while training the psychologist and mental health professionals on trauma management is important, but they just form in these kinds of life experiences. I would also like to caution that not everyone needs to go into therapy, and not everything needs to be routed that way. So there's something which we call a mental health and psychosocial support pyramid. And if you look at the pyramid, it's on the top are the few people who would require psychological medical help, then some that will require help of nurses and doctors, just basic support, and the lower 2 layers, the most support is needed in the daily functioning, getting the groceries done, looking for jobs. Parents who got adults or children injured in the family as a result of the terrorist attacks, they would need a lot of support in managing that. And so if we are able to address these issues and the community and family at large is supportive, that is what most of the people would need. There will be few who would require specialized trauma counseling and therapy. So not everyone would require that. So there is a lot that communities can do and provide support with.
Now, I want to kind of dial it back just a little bit, because we have talked at length about violence and about, for example, terrorist attacks. But I also am curious about how to deal with, what is seen as a normal part of life, loss and bereavement, like I don't want to say regular, but the expected losses, but those are tremendous losses that everybody is just knocked sideways by. Zehra, so could you sort of, so for example, the loss of a parent is something that everybody will experience in their life at some point. Most of us will. So how do you know whether the way you feel is all right, and how do you know when you should seek a therapist or some kind of professional help? Because like you said, grief is variable, and everybody will grieve and mourn in different ways. But how do you know if this is appropriate or not?
So I think it's a very important question, and considering we're going through the third wave of the pandemic and there are so many losses that people are experiencing, what I would say is that some common reactions are anger, guilt, sadness, really missing the deceased person, and these are all normal and natural parts of grieving and reactions. So first important thing for any person who's lost a loved one is to know and to recognize that all the feelings that they're experiencing right now are not natural and normal, even if they feel guilt, even if they feel relief that the person is no longer suffering. They're all natural and normal, and that nobody can tell them this is what they shouldn't say, this is what they should not feel. So there is no right and wrong of feeling the way they're feeling, and they just need to do whatever they need to do to look after themselves. If it helps somebody not talk about the issue for a little while, that's fine. If somebody wants to get busy with something else, if somebody wants to cry and talk more than others, that's okay too. They're all part of the grieving process. If somebody keeps avoiding, say even if 6 months have passed, doesn't want to talk, doesn't want to see anything, that becomes problematic. And if people say, even if a lot of time has passed, say 6 months have passed, this is technically what we say, and the person is, the symptoms that the person was experiencing, which were all natural, they haven't, the intensity is still the same, or that the guilt is too profound, or they are unable to function. Initially, if somebody cannot, sleep properly or can't do things, but if they continue, they are unable to sleep, they're unable to concentrate, they have suicidal thoughts, there's a lot of blame, then that is slightly problematic, and that means they probably require some kind of professional help. Besides that, whatever they need to do to feel better, whether it's remembering the person, for a lot of people, the mourning rituals, talking to family, remembering the deceased, these are very, very helpful ways of coping. And now with this COVID pandemic, you can't have the kind of burials, you can't have the kind of mourning. It's even further complicating people's ways of processing their grief. So, and with children, I think sometimes we try to avoid talking to them, and we say that, okay, let's tell them, oh, the person has gone to sleep. Now they keep wondering whether the person will come back. And children have what we call magical thinking. So they will attach everything to themselves. So, okay, maybe I wasn't a good child, and that's why my parent has gone away. I must have caused my parent to go away, or my parent must have died because of that. So really looking for those, clarifying those to the children in an age-appropriate manner would be very important. And of course, the people will have different ways of looking after themselves. So being there to support people, but not really pushing people to feel a certain way or not to say certain things is very important.
I think that that's really, really important. And Shafaq, I want you to sort of tell me a little bit about this, is that it is so crucial to not say certain things and to not push people, because I feel like, I can't speak for other cultures, but this certainly happens here, that if you aren't displaying certain kinds of appropriate grieving responses, then people don't think that you are feeling your grief enough. Or a lot of people say a lot of really insensitive things to children and just to family members in these situations. And it's just something which is just really awful. And I don't think that people realize how inappropriate it is.
Absolutely. And I think I would begin by linking it back to what Zehra and Dr. Fatima are saying about pathologizing the grief, as well as, having very individualistic approaches to addressing grief, right? Yeah. And you brought it up as well. You talked about how it burdens certain family members, for instance, right? So if you just allow me to start with that, and then I'll come back to the ethics of supporting family members. So I think the biggest issue for me, at least, that I have noticed through my interactions, is that this individualistic approach never works. So, and I think the pandemic has made that absolutely crystal clear, that there can be no single way or an individualistic way of approaching that. Grieving can be a collective responsibility, and it needs to be treated as such, whereby we are recognizing that we don't just have to come together and grieve the loss, or we need to mourn the loss, but also we need to have a very victim-centric approach to grief, whereby we recognize and we prioritize and we respect the needs of the victim, right? Where by, we are also mindful of what it is that we need to say, and also when is it that we need to step back and we need to allow the person some space or some, some bandwidth to at least deal with their emotions. And related to that is then something we talk about and is known as the circle of support, right?
The circle
and
of
this
support.
Is something Dr. Fatima introduced me to, whereby at the center, at the core of that circle is the person who has experienced that loss. These can be multiple people, right? Loss of father, but also loss of husband, etc. Then there come friends and family. Then there come local organizations such as TGD. And then at the outermost circle, we have professional support, right?
Right.
And even within the innermost circle, you have these different layers whereby the needs of a child need to be prioritized, right? Because they are not able to make sense, or they're not able to process their emotions, just as Zehra pointed out. And somebody my age is, even though grieving, is in a better position to lead them through it, right? And that proximity also, I think, defines how candid or how involved we should be with somebody's issues. How much is it okay to probe? It should never be okay to probe, right? We also talk about how there are certain occasions when perhaps we need to step back and we need to look at the time, the place, and whether or not it's important for us to be there. So for instance, local organizations should not go the very next day a person has lost their loved one in a terrorist accident, right? Or even distant friends, distant family members shouldn't be there. Neighboring community shouldn't be there on the very first day.
But
that should be a circle that should be limited to just friends and family.
If I did interrupt briefly, would this be different for families who were grieving, let's say, somebody who died of, a prolonged illness, or a situation where you were, like Fatima said earlier, prepared for that loss? Would that entail a different approach, or would this sort of sensitivity apply almost equally?
So when I say we need to have a victim-centric approach, we also need to realize that there's no generalized way of dealing with it, right?
Okay.
So even if people are prepared, they may not be ready for that particular moment.
Exactly,
right?
because when it happens, it's horrible, even if you were expecting it. Yeah.
So, which is why I don't think there's a particular generalized approach. We need to vary it. We need to have empathy in a way that our empathy evolves according to the person we're dealing with, or the family that we're dealing with, right? And reach out, see whether or not they want us there, and perhaps then offer them our support, right? So I think that is the approach we should take, but perhaps Dr. Fatima can elaborate whether or not she thinks that is the way to go.
Absolutely, and I want to ask her in great detail, but first, a quick break. Stay with us. Welcome back to the coffee table. We've been having such an important conversation about grief and trauma with Dr. Fatima Haider, with Zehra Kamal and Shafaq Sohail from the Grief Directory. And I think that, it's just wonderful. This is one of those kind of shows. I'm so grateful for all three of you to have taken the time to have this conversation with me, because I have learned so much, and I'm really, really hopeful that this is going to help so many other people. Fatima, I wanted to ask you about how Zehra mentioned about pathologizing grief. So what does that mean? And do you think that there is sometimes a stigma around how people deal with their grief? Like there are certain sort of, people expect you to mourn in a certain way, but everybody, again, like we've been talking about, has their own way. And a lot of times people should get professional help. And do you think that they often don't because they are afraid that, they'll be judged for not being strong enough, for example?
Thanks, Mina. It's a very important question. I think in order to understand what pathologizing grief is, the first important conversation that I think is often missing in our society is differentiating between psychiatric support and psychological support.
Yes.
These are two different things.
Very different.
While psychiatrists can offer support through medication, psychologists have a totally different approach.
Yeah.
So I think this is something that we've often experienced with our work with the victims as well, and even in general as well, that when you offer, suggest to people that they may need to talk to somebody, they think that they are going to offer medication as well. So this is one very important differentiation that needs to be made.
Yeah.
Secondly, I think as opposed to, and not just opposed to, another point added to probably pathologizing is the stigmatization as well.
Yeah.
So sometimes you don't realize that you need psychological support. At other times you do need to speak with somebody, but because of the fear that you will be judged or labeled as somebody who's not sane enough, unfortunately, because we sometimes use very harsh words, unfortunately, for people who are struggling.
Yes.
So he has lost his mind, he cannot function, things like that. So sometimes people are really, really fearful of reaching out to help.
No.
And I think built on that, the third level is that if somebody does decide to reach out to help, the third thing is that where should they go? So if, like as a GP, I know that our health infrastructure does need a lot of reforms when it comes to mental health support. We don't have emergency psychiatric support strong enough that if somebody is having a psychiatric emergency, where should we take those people? We don't have GP systems who would refer you to the psychiatrist. So a lot of specialists find it very burdening that things that can be dealt at the level of the GP, again, as I mentioned, that GPs can be family physicians they used to call. So they could speak to the person and they could speak to the family.
Yeah.
A lot of the quote-unquote psychological issues could be addressed before reaching out to a psychologist or a psychiatrist. I think in general, since we're talking about behaviors of the society, it is very important to listen and it is very important to be there. But I think the point that I want to make is not to offer advice, please, unless it is specifically asked.
Yes.
Something I think we should from the West. We, unfortunately, are very, very advice-focused. So, if anybody's talking about their problems or their trauma or their grief or their just emotion, we always feel that it is our responsibility to offer some sort of advice.
Yes.
So when we talk to young interns that come to us and then we finally connect them to the victims of terrorism as well, just to build a bond of empathy, we often talk about how important it is to sometimes remain silent and be quiet and just be there with the other person.
Absolutely.
Rather than a solution-focused approach.
Do you feel like that usually comes from, again, that discomfort that we were talking about earlier in the show, where people feel like this should help you by giving you advice or saying that, yes, I also know how you feel, but it's counterintuitive, because then what you are doing by offering advice or an anecdote is that you are making the conversation about yourself, when in fact you should be holding space for the person who is trying to share something with you.
A very valid point that Shafaq made when she talked about the rings of support. For that, we promote at the Grief Directory platform that you should offer your support inwards towards the one who need more help. And you should deal with your own grief outwards with your outer circle of friends. So it is undeniable that not just the center of the core, which is the widow, which is the parents, and which is the children who are suffering, but extended family is also suffering. So if a mother is seeing her daughter being widowed and suffering, she's also someone who needs to talk about. But then she needs to talk to her extended family system. And similar is with the siblings as well. The grief of siblings sometimes goes unaddressed because they're just there to offer support and their grief is never talked about. So this is, I think, very important that we should realize that who should be there to support offer to whom and how to build up these connections. And we should talk about it on different platforms.
Yeah.
Then sorry, you think.
No, I had a question I wanted to ask Zehra here. That Zehra, when we are talking about violent, and we've been talking about violent and terrorist trauma, how does one deal with survivor's guilt associated with that?
I think, you'll keep hearing me say that, and I keep repeating myself that again, there's no right or wrong way.
Yeah.
I think the important thing is to bring it up and just to let people talk and let people process and let people express. And that's all one can say, because the healing comes with when there is opportunity for people to talk, where they feel they will not be judged. And when we try to, I was listening to the conversation, and sometimes we feel so uncomfortable when people talk that we try to comfort them by saying, don't think this way. Stop feeling this way. It'll be fine. And that's our own way of helping them, but one doesn't need to, because it makes them feel like their issues are being trivialized. So, and I think, again, if somebody talks to you about it, letting them know that, listen, a lot of people also experience that, and that's fine. So that's one thing that is a huge comfort, to know that this is not them feeling a certain way where others may not be feeling this way. Yeah.
Yes. Quite right. Previously in the show, we talked about how we try to rationalize traumatic, sudden, terrible things that happen to us, and we try to make sense of them. And I feel like one way of trying to make sense of that is by being a little fatalistic about it and saying that perhaps this was God's will. And do you think that is, how helpful is that also to say to somebody who is grieving?
I think us saying that will not make sense. If the person themselves feel a certain way, that's okay. Again, I'll refer to the research that I did. It's a very small scale one, and a lot of the parents were coping through these religious beliefs that, okay, it was supposed to happen, this was meant to be, and we know that this person is in a better place. But this will not apply to everyone, because if you say to somebody who's not feeling this way, and especially who's lost a loved one in a senseless act of terrorism, it's not going to help. So while faith and religious beliefs can be very helpful in helping people cope, we shouldn't be pushing them down somebody's throat who's not feeling a certain way about it. And that's important.
Fatma, I've been thinking about how we've been talking about children, for example, and how they are very vulnerable, especially when they're trying to come to terms with grief. Are there other vulnerable groups that need our support, but we often don't kind of think about that when we are sort of trying to support a grieving family?
Mina, I would like to mention that, yes, there are some vulnerable groups which do become invisible. So, for example, if you're talking about terrorism conflict,
yes,
if a bomb blast happened in a mosque, it will be mostly men who lost their lives, unfortunately.
Yes.
So when we talk about the casualty numbers, we talk about the men, unfortunately, who've been lost, but we never talk about the families who've been left behind. And those families would include women, and then children, and then, unfortunately, in some situations, old parents as well.
Yes.
So these are some of the vulnerable groups. But when we started the grief directory, and because it was very personal to me, I was looking for the rescue worker who had held my son's hand, and I wanted to know what was his last words, was he in pain? And through that, we connected with the Rescue 112. And I'm eternally grateful to them for the kind of support that they offered. But then we did a small bit of research activity with them of about 100 participants. And what we realized was that what we are also ignoring is another population of invisible communities, which are the first responders. And these first responders include both the police as well as the rescue workers, who are the first ones to be there at any site of trauma, be it a violent incident of terrorism or fire or
even
a
just a
building
medical
collapse,
emergency.
or even just a medical emergency when they take a patient to the hospital. So I think that in order for them, even on a very organizational level, in order for them to perform better, it is very, very important to address their trauma, which is called the vicarious traumatization, which is the concept that if you keep on looking at violence in different forms, be it on media or if you're there in person, it does affect you. Yes. So I think in Pakistan, a very, very important conversation that we should begin with is how to address the trauma, the vicarious traumatization of our first responders.
Yes.
Secondly, I would like to say that media has a very, very crucial role when it comes to dealing with traumatized communities, because they are the other who are always there on the traumatic side.
Yes.
So on sites where trauma has happened. So are we doing anything to help them to address their own trauma? That is number one. And number two, how should we train our young budding journalists and young budding media professionals that they are well equipped to talk to the victims and other traumatized communities before they reach out to them? What kind of conversations, again, what Shafaq mentioned, when to reach out to families, what to say to them, what not to say to them, and how should this be communicated to the public so that it builds a bond of empathy rather than create apathy in the society, where the society thinks that it's just another number and we should move on.
Absolutely.
So I think training
of the really leading by example also. I think that sensitive, empathetic reporting would also show people watching how to speak to people in those situations. Well, thank you so much, Fatima, Zehra, and Shafaq, for being with me today and this very, very important and difficult conversation. Thank you so much for the work that all of you are doing with the Grief Directory. The Grief Directory is on Facebook. If you sort of do a quick search, you'll be able to find it in a jiffy. We will all at some point experience grief and trauma, but the important thing, what I have at least learned from this conversation, is that none of us are alone in this, and that friends and family and people who love you need to step out of their own comfort zones to be able to comfort and help people that we love and care for, and that this is the importance of community. And I feel like a lot of times our cultural conversations revolve around a great deal of pride about how we are, we have a strong family unit, so we have strong friend networks, so we have strong community. But these are the instances where really you have to put your money where your mouth is. It's not enough to just be proud of it and pat yourself on the back, but when real life happens, how do we respond? And it is a continuous process of educating ourselves, and I hope that this show today has been one small step in that education. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.